Hi guys, I'm Lindsay Owens, and this is my patient Olivia, and I'm going to be performing the head, eyes, ears, nose, and throat assessment. And so I started the assessment by gathering my supplies, providing patient privacy, explaining the procedure, and doing hand hygiene. And so I'm going to start by looking at her overall health status. And so she looks like she is neat and clean, and her nutritional status is that she eats a well-balanced diet and is maintaining a healthy body weight. And her skin is pink, warm, and dry. And overall, she is alert and oriented. Her mood and affect and speech and hearing are all within normal limits. And so I'm going to go ahead and start with the head assessment. And I'm looking at her head, and it's symmetrical. There's no obvious deformities. And so I'm going to go ahead and palpate her scalp and cranium to make sure that it's smooth and no lumps or bumps are present. And then I'm going to go ahead and assess her temporal mandibular joint. And so can you open and close your jaw twice? Awesome. And then I'm going to feel for her temporal artery. Okay, and then I am going to go ahead and move on to the eyes. And so I'm going to start with the confrontation test, and that is testing the peripheral vision. And so whenever I'm going to do this, just look at my nose or just straight ahead and tell me whenever you can see my fingers.
Good.
Okay, and then I'm going to test your peripheral vision, superior and inferior. So tell me when you can see my fingers.
Good. Good.
Okay. And then we are going to do the 6 cardinal positions. And so just look straight ahead and then follow my finger. Just don't move your head. Okay, and then follow in. Awesome. So that was all right. And then I'm going to shine the light in your eyes. Just look straight ahead. And then I'm going to go on the other side. Awesome. And if we were to do the Snellen's test, that would be I would have Olivia sit here and then place her 20 feet away from the chart that had the letters on it, and not allow her to use any visual aid, but have her start from the top where the letters are the biggest, going down to the bottom and reading the letters as she goes until she can't see it anymore. And then I am going to look at the external structures of her eye, and all of it is within normal limits. There's no swelling, arrhythmia, or jaundice. And so then I am going to go down to the nose, and with her nose, it is symmetrical. There's no deformities, and so I'm going to test the patency of her nose. Can you breathe in and out? And then in and out. Awesome. Okay. So then I'm going to go ahead and take a look inside of her nose. And the mucosa and the septum are within normal limits. The septum's not deviated. So then I'm going to go down to her mouth, and her lips are moist. They're not dry or cracked. And then can I go ahead and have you open up your mouth? Okay, so her teeth are white, and her gums are pink, and they're not bleeding. And then her tongue is even throughout with no cracks. And can you say ah?
Ah.
And stick out your tongue. Awesome. And then I'm going to go ahead and shine the light in the back of her throat. So her palates are within normal limits. They're not super red. The uvula is mobile and pink as well. And so I am going to go down to her neck, and her trachea is midline, and it's symmetrical, not deviated. And I'm going to go ahead and feel for her lymph nodes. And then okay, so that is all good. And then I'm going to go ahead and do the thyroid assessment. I'm going to get behind you. And this might not be the most comfortable thing. Okay, so I didn't feel anything abnormal with that. And then I'm going to go to, or I'm going to feel her carotid pulse as well. All right. And then moving on to the ears, I'm going to look at the external ear. There's no swelling, there's no lesions, there's no drainage. And same with that one. So then I'm going to go ahead and look on the internal ear and use my otoscope. And so her canal is not obstructed, there's no excess earwax. And then her tympanic membrane is pearly white and gray and translucent. Let me look on this side. And then same with this side. And I think that might be it. Okay.